both myself and Kathryn are going to be presenting an overview of the Psychosocial Survey that was carried out in all 4 countries as part of the Ni3 project. So a general overview of the work package as a whole, first of all. So there were 2 key components. The first one being a large-scale psychosocial survey, of which the aim was to assess children and young people's experiences of violence and abuse in the 4 partner countries, being India, Jamaica, Uganda and the UK. This is going to be the primary focus of today's presentation. The other key component is the testing of a gaming trial, which will test the effectiveness of context-specific gaming interventions designed to educate young people about particular types of violence and abuse. That will be presented in more detail tomorrow. So there's various connection between the work packages. So essentially work package 2, so the semi-structured interviews, predominantly were the basis for the game developments and the themes that were contained within the 4 different games. And as such, work package 4 was then partly based on the findings from work package 2, and a lot of the contents within both the gaming trial interventions, so the surveys we've developed for those, are based on findings from work package 2 and based on the themes that are presented within the games developed within work package 3. So in terms of the content of the psychosocial survey, predominantly this was about child maltreatment, the definition of which provided by the World Health Organization is that child maltreatment is the abuse and neglect that occurs to children under the age of 18, resulting in actual or potential harm to the child's health, survival, development or dignity in the context of a relationship of responsibility, trust or power. Typically, any statistics or research that looks at child maltreatment typically pertains to physical abuse, sexual abuse, emotional abuse and neglect. But increasingly there has been debate around involving exposure to domestic violence within the umbrella of child maltreatment. And then in more recent times there's also a strong overlap of sibling violence. Generally speaking, quite a lot of research finds quite a lot of overlap between maltreatment exposure to domestic violence and sibling abuse, and as such there appears to be quite a fair bit of justification to involve all 3 different types when looking at various experiences that children have. So in terms of prevalence of maltreatment worldwide, half of children experience violence each year, which is quite a shocking statistic. These victimisation rates range from 10 to 93%, so quite a varied range of prevalence figures there. It's estimated that between 1/4 and 1/3 of children will be exposed to domestic violence at some point during their childhood. From a UK perspective, more than 1/4 of children in the UK experienced sibling bullying in the past 6 months. With regards to other countries, this particular figure is not as well published. As such, we know that the rate and type of violence that children are subjected to, it varies significantly across continents. The amount of published data varies, and as such, this requires a specific need for population-specific data. What we know about maltreatment is that single types of maltreatment, they don't occur in isolation. As I've previously said, there's quite a lot of overlap between the types of maltreatment experienced, exposure to domestic violence within the home, sibling abuse, and all sorts of other things, not even taking into account peer-on-peer abuse and things like that. Around 1/3 of maltreated children report being subjected to at least 2 forms of abuse. And we know that children exposed to domestic violence are 2.5 times more likely to be physically abused, 9.5 times more likely to be psychologically abused, and between 1.5 and twice as likely to be neglected. And around 30 to 60% of maltreated children are also exposed to domestic violence within the home setting. There's quite a few psychological implications to this, as I imagine can be expected. Being subjected to any form of maltreatment, whether that be physical, sexual, emotional, neglect, or being exposed to domestic violence, leads children to be 2.5 times more likely to experience a depressive disorder and 1.7 times more likely to develop an anxiety disorder. We found that exposure to 3 types of maltreatment almost doubles the risk of developing either depressive or anxiety disorders. And maltreatment is associated with increased risks of suicidal behaviour, including attempts. So the international objective and part of the reason for carrying out some of this research is that a critical element of the 2030 Agenda for Sustainable Development, which was put forward by the United Nations, is that every child is protected from violence, exploitation and harmful practices. This particular goal was reviewed by the World Health Organization in 2020. And as part of this, there's been some development of national legislation and policy to protect children from violence, but however, there is a lot more to be done. As such, currently 88% of countries have laws in place for preventing violence against children, but however, only 47% of countries thought these were being enforced strongly enough, and only 25% thought prevention and response approaches from agencies were sufficient to reach all children that needed them. So there is quite a fair bit of rationale for the country data that has been collected part of the Psychosocial Survey. As such, the World Health Organization put specific emphasis that countries should prioritise collection of data on key violence-related indicators. It was a requirement that countries highlight the prevalence and extent of abuse that children are subjected to, and that this is used to inform development and implementation of laws and policies to prevent violence against children and adolescents, and that this information should be used to allocate planning and budgeting for effective interventions and services. However, currently only 1 in 5 countries have sufficient data to actually start working towards these targets. So some examples of missing data and the reasons that we need to start bridging the particular gaps on prevalence figures is that in some countries, absence of laws means that certain forms of violence against children is not recorded because it's not considered an offence. So one example of this would be within India having no laws against non-sexual abuse within the family. And even where violence is criminalised, there is quite a lot of vast underreporting. So a national report by CACA in India in 2007 found that only 3.4% of sexually abused children actually reported their abuse. And while findings from UNICEF provide figures for physical and psychological violence in Jamaica, more specific forms of violence are not as well reported. Another reason for trying to bridge the gaps in terms of finding out about prevalence and figures is that we do know that there are quite a number of reasons for underreporting. So particular issues include stigma, being shamed, fear of not being believed, and a whole host of other reasons that we don't have time to go into today. Another particular reason is that certain forms of violence against children have been normalised within certain societies. So, for example, corporal punishment is routinely regarded as an acceptable means of disciplining children, and as such, societally may not necessarily be considered as a form of abuse. So within various countries, we are aware of some national victimisation surveys. However, some of the information that these capture are kind of far from adequate. So, for example, the crime survey for England and Wales, although quite a comprehensive survey, it does not capture abuse experienced by teenagers aged 16 to 17, and this is despite pretty universally regarded definitions of child being somebody under the age of 18. So as such, we've got quite a big gap there in terms of what we know about prevalence. It's also based on retrospective recall from adults aged 18 to 74, and as such, this doesn't actually give us a particularly good overview of the current levels of violence that children and adolescents in the UK are experiencing. Other surveys, such as the International Crime Victims Survey, although it's been conducted in 80 countries, from what I could gather, it appears the last round of surveys were conducted around 10 years ago, and as such, we know that definitions around certain offences have changed since then, so we don't have the current overview. And furthermore, we do have some information from the Uganda Ministry of Gender, Labour and Social Development. However, as far as I'm aware, this was last conducted in 2015. So, Psychosocial Survey had a number of objectives, predominantly to examine occurrence and co-occurrence of physical, sexual, emotional abuse, neglect, exposure to domestic violence and sibling violence in the 4 partner countries. We wanted to look at the setting of abuse, so whether this occurred within or outside of the home. We wanted to inspect patterns of abuse among different genders, ages, ethnicities and locations. And we wanted to look at the associations between maltreatment and mental health, and particularly look at symptoms of anxiety, depression, suicidal self-injury, suicidal ideation and suicidal attempts. So within the survey, we measured a number of different indicators. So we measured some socio-demographic data such as gender, age, ethnicity and their living situation. So did they live in a 2-parent household, single parent household, how many siblings, all that kind of thing. We had a look at a number of different types of maltreatment. We had a look at sibling abuse, exposure to domestic violence, which in this case was exposure to physical domestic violence, exposure to verbal domestic violence, or exposure to drug-related threat. And for mental health outcomes, we used PROMIS, which is a quite comprehensive survey that looks at a number of indicators of anxiety and depression. And we had items asking about any experiences of partaking in non-suicidal self-injury, any suicidal ideation and any attempts. So for our maltreatment indicators, by physical abuse, we had 2 main parts to this, one being corporal punishment, so for example being slapped or being beaten with an object, and other physical abuse, so being punched, kicked, locked up, tied up, choked, all those not very nice things. For sexual abuse, again, 2 main forms, so contact sexual abuse and non-contact sexual abuse. Non-contact pertaining to things such as making sexual comments, being shown pornography, being exposed to or being made to expose themselves, and things like sexual photographs. We measured emotional abuse, and this was things like being embarrassed or shamed, being called names, being made to feel guilty, being threatened, so being threatened to be kicked out of the home, hurt or killed. And then we measured a number of different forms of neglect, physical, medical and emotional neglect.
So as you can see, our survey was pretty comprehensive, measuring a range of different types of maltreatment, exposures to domestic violence, and also the potential mental health outcomes of these forms of violence as well.